Antipsychotic medications. Antipsychotic medications block which receptor? Is it dopamine, serotonin, acetylcholine, or epinephrine? What do you guys think? Choose your answers. Okay, very good. Most of you guys chose the correct answer, and it's dopamine. You guys need to know this. That is a job. That's what the antipsychotic medications do. Remember, dopamine is important for the control of impulses, movement, coordination. Okay, so it blocks the dopamine receptors. Now, serotonin. What is serotonin? Remember, that's our feel-good neurotransmitter. That's what helps prevent depression. Acetylcholine. That's a catecholamine, and what that does, it communicates between the nerves and muscles. And then we have epinephrine. Remember, epinephrine, that's responsible for our fight or flight response. But when we're talking about what type of antipsychotic is going to block and what receptors do the antipsychotics block, it is the dopamine receptors. What's the safe dosage range for lithium? This is very important, and Klex expects you to know this. Is it 0.4 to 1, 0.6 to 1.2, 1 to 2, or 2 to 3 milliequivalents per liter? What do you guys think? Very good. Most of you guys chose the correct answer, 0.6 to 1.2. And remember, lithium has a very narrow therapeutic index, and Klex absolutely needs you to know this range. When are antipsychotics contraindicated? Select all that applies. How do you treat select all that apply as true or false? For these purposes, I'm not going to do it that way because I want you answered on your own. But what do you think? When are antipsychotics going to be contraindicated? For elderly patients with dementia, glaucoma, active alcoholism, pregnancy, lactation, thyrotoxicosis? What do you say? Really, guys, only 14 people answered. So let's talk about this. When it comes to antipsychotic medications, they are going to be contraindicated in the elderly with dementia. Let's talk about this. Think about it. First of all, the elderly, when they take antipsychotics, increases their risk of having cardiovascular events and even death. And think about it. This patient already has dementia, which means that they're not in touch with reality for some portions of the time. Why would you be giving an antipsychotic to them anyway? Let's say you didn't even remember the portion of them being elderly, but just the fact that they have dementia. Giving an antipsychotic to an elderly patient with dementia severely increases their risk of cardiac events or death. Next, glaucoma. Think about it. Why would glaucoma be contraindicated in antipsychotics? Okay, well, do you understand that antipsychotics also have anticholinergic properties? What did I teach you guys about anticholinergics? Do you remember that poem? Can't see, can't spit, can't pee, can't, you know what? Can't see, blurred vision, can't spit, dry mouth, can't pee, urinary retention, can't, you know what? Constipation. Right? So a medication that has anticholinergic properties is already going to give them vision problems. Does that make sense to give it to somebody with glaucoma? Absolutely not. Another one, active alcoholism. Come on, you guys know better. You never take medications with alcohol across the board. That was an easy one. Pregnancy, yep. It's not safe for a woman that's pregnant. It's not safe if you're breastfeeding because it does cross through the breast milk. And thyrotoxicosis, let me explain why. That patient with thyroid disease that's in thyrotoxicosis, that disorder actually lowers the threshold for seizures. So the patient who is taking antipsychotics, if they happen to have thyrotoxicosis, they are much at risk to have seizures. So that's why it's contraindicated in the patient with thyrotoxicosis. True or false? Patients receiving antipsychotics should have a baseline and periodic ECG during therapy. True or false? What do you say? True. Absolutely true. So here's the thing. Excuse me. I'm sorry, guys. Here's the thing. These medications, the antipsychotics, they can cause increase in QT interval, so it could cause cardiac dysrhythmia. So you want to make sure that that patient doesn't already have an underlying cardiac issue. So you absolutely want to do an ECG before they start so you can have a baseline, and periodically during therapy just to make sure that patient's not experiencing any adverse effects cardiac wise. What lab values must be monitored for the patient on antipsychotics? Select all that applies. Remember, guys, select all that apply as true or false. WBC, RBC, oh, I put WBC twice, oh boy, BUN, creatinine, and LFTs. That second WBC in green, I meant it to be platelets. I'm so sorry. I've been so sick, guys. I don't, who knows what I was thinking when I was making this. Just rock with it. Okay, so let's talk about this. One of the adverse effects that antipsychotics can cause, it can cause blood discretions. It can cause problems with the blood cells that are formed within the bone marrow. So think about it. What blood cells are made in the bone marrow? The WBCs, the RBCs, the platelets. So right here, the WBCs, automatically that patient who is on antipsychotics, you're looking at the labs, you're going to be looking at those WBCs, because if it's severely decreased, the patient's going to be at risk for infection. RBCs, if that's severely increased, patient could be at risk for what? Anemia. And this second WBC, what I meant to put here was platelets, because that's the third blood cell that's made in the bone marrow. And if that's severely decreased, platelets, what are we going to be concerned about? Bleeding, right? Let's keep going. BUN. Why would we be concerned about checking the BUN? Because we're going to be concerned about the patient's kidney function. Remember, the kidneys are responsible for excreting the medication. So if the kidney's not working the way it's supposed to, patient's not getting rid of the medication the way that they're supposed to, they may have a toxic level. Same thing with creatinine. Creatinine will give us an idea of what's going on with the kidney. So we care about that. We're going to look at the creatinine as well. LFT, those are my liver function tests. Why do I care about the liver? Well, the liver is responsible for doing what? Metabolizing these medications. So these medications are not being broken down the way that they're supposed to. They're not going to be excreted the way that they're supposed to, and the patient may have a toxic level. So we are going to be concerned about WBC, RBC, platelet, BUN, creatinine, and the liver function studies. We're going to be looking at the ALT, the ASTs, all that good stuff. Excuse me. True or false? Sugarless candy and ice chips should be provided to the patient on antipsychotic medications. True or false? What do you think? Okay, more people chose true than false. Very good. So this is true. Remember I told you that antipsychotics have anticholinergic properties. What do we know about anticholinergics? Again, don't forget that poem. Can't see, can't spit, can't pee, can't, you know what? So that can't spit, that's the dry mouth part. So you're going to help encourage that patient to suck on sugarless candy or sugarless gum or maybe even ice chips to alleviate that dry mouth that they would be experiencing. In the manic phase of bipolar disorder, what should be the nurse's priority? Select all that apply. How do you treat select all that apply? As true or false. Hyperexcitability, depression, nutrition, rest, fluid electrolytes, fear. What do you guys think? Let's go over this. So we're talking right here, we're talking about bipolar disorder, right? And in bipolar disorder, we know that this is a disorder where the patient suffers extremes, where they'll go from one end of the spectrum to depression to the other end of the spectrum, which is, hyperexcitability, right? So that's what bipolar disorder is. And the question is, what is going to be the nurse's priority? Guys, every single day of the week, your priority is going to be what is going to keep your patient alive and safe. You have to think of physiological integrity. So let's look at this list. Hyperexcitability, no, that's just a portion of bipolar disorder. That's not going to be our concern. That's just a part of their disease process. Depression, no, that's also a part of the disease process, but that's not our concern for the patient. Nutrition, absolutely. Absolutely. Because if that patient is on the depression end, they may not want to eat. And if they're on the opposite end, which is hyperexcitability, they might be so excited and high on life, they're too busy enjoying their life that they forget to eat. So nutrition is very important, because without nutrition, is that patient going to stay alive? No. Next, rest. Absolutely. Doesn't rest fall under physiological integrity? Let's think about it. A patient with bipolar disorder, if they're in the manic phase, they're going. They are not going to stop to rest. And then they can crash. The patient's not going to be safe if that happens. And on the other end of the spectrum, if they're severely depressed, patients who are severely depressed either sleep all day or they don't sleep at all. Rest is absolutely an important factor. Fluids and electrolytes. Doesn't that fall under physiological integrity? Yeah, that'll kill a patient very fast if they don't have enough of it or too much. So we're going to be concerned about that if the patient's not getting enough. Fear, no. Let me tell you something, guys. When it comes to patients' emotions and their thoughts, yes, that's important, but it's never going to take priority over what falls under physiological integrity. So write this down if you have a pen, because you need to get this through your mind. When it comes to physiological integrity, you're going to care about fluids and electrolytes, food, nutrition, rest, vital signs, hemodynamic status, anything that physically keeps your patient alive or keeps them from dying. True or false? An adverse effect of antipsychotics are trap symptoms. True or false? If you watch my videos, you know what those are, or if you've been studying in the book, you know what that is. Very good. True. So the antipsychotics can cause something that's known as Pseudoparkinsonism. Pseudo meaning fake, false, and then Parkinsonism, Parkinson's disease. So this word trap, T-R-A-P, these are the symptoms that we see in Parkinson's disease. T is for the tremors. R is for the rigidity. A is for the ataxia or akathisia. P is for the postural, what's the word I'm looking for? Postural instability. So this patient is at risk for falls. We are going to be very concerned about this patient's safety. And because antipsychotics can cause the patient to have pseudoparkinsonism, we expect to see these trap symptoms. Again, tremors, that rigidity, ataxia or akathisia, and postural instability. What are the significant adverse effects of antipsychotics? Select all that applies. Hypotension, anticholinergic effects, sedation, extrapyramidal effects, nausea, pruritus. Excuse me. Okay, so let's talk about this. Hypotension, true. Remember, select all that apply. We have to treat it true or false. Yes, because these antipsychotic medications, they have sedating effects. They bring things down. So we expect to see the blood pressure go down. Patient can have orthostatic hypotension. That can cause a safety issue. So hypotension, true. Anticholinergic effects, true. I've been talking about this since the beginning of the Kahoot, that antipsychotics have anticholinergic effects. Can't see, can't spit, can't pee, can't you know what. Sedation, true. Extrapyramidal effects, yes. What are examples of those extrapyramidal effects? Those trap symptoms that I just explained to you in the previous screen. Not nausea. Nausea is a side effect, but it's not an adverse effect, and it's definitely not a significant adverse effect. That's why we didn't choose it. And pruritus, that's not an adverse effect. So adverse effects for antipsychotics are going to be your hypotension, specifically orthostatic hypotension, anticholinergic effects, sedation, and extrapyramidal effects. We're down to our last question. What's the most common psychosis in which delusions and hallucinations are hallmarks? Bipolar disorder, schizophrenia, dementia, or delirium? Very good. Most of you chose the correct answer, schizophrenia. So I already explained to you guys what bipolar disorder is, but I haven't really talked to you about schizophrenia. So in schizophrenia, the patient is having hallucinations or delusions, but usually they're having hallucinations that are either auditory or visual. So they're seeing things that are not there, or they're hearing sounds which are not really present. Now let's talk about the last two, dementia and delirium. As students, you guys tend to get these two confused. So let me clear this up for you right now. There's a big difference between dementia and delirium. Dementia is progressive. As time goes on, it only gets worse. With dementia, there is no cure. It is not reversible. With dementia, this is chronic. This is long-term. Where delirium, on the other hand, it is reversible. As soon as you find what the underlying cause is, the patient's not going to be confused anymore. It's not something that's progressive. And especially in the older patients, when you see they have delirium, the first thing that you need to be thinking about is infection, because most likely they have some type of infectious process. And once you figure out what's going on with them and you can get them the proper, either antibacterial medications or whatever it is that that patient needs, they won't be confused anymore. So make sure you guys know the difference between dementia and delirium. So let's see who won this Kahoot. Maya, number 3, very good. Julie, second place. First place goes to D. Congratulations. Runners up, Sui and BG. Great job. Excuse me. Guys, let me know what you thought about this Kahoot. And if you enjoyed it, if you'd like me to do more of them here on YouTube, please let me know in the comment section. Let me know if there's anything that you'd like me to do a Kahoot on. I'll definitely add it to my list. I've been doing Kahoots on TikTok, but I decided to do them here on YouTube as well. So let me know what you guys think, what you guys like to see me cover next.